Thank you, everybody, for joining us and welcome. I'm Lisa Curtis. I'm the Director of Development and Community Engagement at the Space Science, not at the Space Science Institute, at VIA Mobility Services. Uh-oh.
Uh-oh.
and I want to welcome you to the Transit Talk today. We're going to talk about on-demand transportation in transit. We basically, you know, we've had on-demand transit, on-demand transportation for a long time. It's called taxis. You could, you know, in the traditional world, long before Uber and Lyft, you could call up a taxi, or you could, if you lived in a busy New York neighborhood, you could stand on the curb and wait for one to pass by and hail it. Now we have on-demand transit in the public transit sphere. Uber and Lyft has kind of sped up that opportunity, really the demand, I think, for on-demand transit. And there are a number of on-demand options that are growing in the public transportation and public transit world. Call-up services like FlexRide have been around for quite some time now. And now we're starting to see on-demand increasing beyond, say, just for paratransit services. So we've got 3 people on our panel today who are going to answer some questions and address the Ride Free Lafayette program that has recently launched in the city of Lafayette. And I'm going to introduce the panel now. Angel Bond is with us today to talk about Ride Free Lafayette. Angel, you want to introduce yourself?
Yeah, thank you, Lisa. So I'm Angel Bond. I'm the Mobility for All Program Manager with Boulder County, and I facilitate what's called a local coordinating council for Boulder County. And we were involved in the pre-planning to apply for the grant that really led to the Ride Free Lafayette service. So I'm really happy to be here today.
Thank you. And Lisa Bitzer, you want to introduce yourself?
Hi everyone. My name is Lisa Bitzer. I am the Director of Operations here at VIA, and I oversee Tricia and her team that have been doing the Ride Free Lafayette and with Pantonium. So I will answer what I know.
Thanks. And Trish Best, want to introduce yourself?
Sure. I'm the driver supervisor for the FlexRide division at VIA Mobility Services, and the Ride Free Lafayette is out of my division, so.
Thank you. So I'm going to start off the discussion, and just to give you kind of an overview of how it's going to work. You can enter a question in the chat function at any time, and Zoe DeVito, who works with me in the development department, will make sure she keeps an eye on the chat because I sometimes forget to look. So break in anytime you want, Zoe, to alert me to some chats. And also towards the end of, we'll have the panel discussion, and I'll ask some questions, and we'll ask some of the questions through the chat. And then at the end, we'll have what I call an open mic. And people, now I'm going to mix my metaphors, we'll throw up a jump ball for attendees to ask questions or answer a question. I see there's some people who are involved with transportation that are on the call today. And the attendees can ask questions of anybody on the panel or anybody in the group. So I'm going to start it off with Angel. If you could give us, Angel was part of the team that wrote the grant proposal to get Ride Free Lafayette started. Maybe you could tell us about some of the underlying needs that the county was trying to address and who they were trying to serve with instituting the service.
Yeah. So back in 2006, we did a Boulder County Transit Enhancement Plan. And we really did identify that there was a gap in the flex ride service in East Boulder County, in particular in Lafayette. And then again in 2015, Mobility for All with VIA Mobility Services and our local coordinating council, we conducted a needs assessment, and we found at that time that there was really a need or a desire to have some sort of on-demand service. And then more recently in 2018, we were really working on some transportation gaps between the city of Louisville and Lafayette. And in particular, we were looking at the food bank at Sister Carmen and how people from the Kestrel community in Louisville could get to that food bank. And it just kind of lined up with some of the same timing that DRCOG had for their Human Services Transportation Set Aside. And a grant funding source became available last year that we applied for. And just with all of our research on transportation needs, we just really felt like it was time to apply for it. It is open to the public, but really the way that we had got awarded the Human Services Transportation Set Aside funds was by talking about our outreach strategy and how we were going to promote the service. So we really talked about those anchor human services destinations that are located within Lafayette and how there was a need to go to Clinica and to Sister Carmen Food Bank Pantry, the senior center. And so we really use that as justification. There's just a lot of human services organizations in Lafayette that we needed to have access to. So it was kind of the trajectory of the planning process. I think I see that Debbie Noel's on the phone call. I remember once she asked me, like, how long does it take to get a new service or get change in the system? And obviously you can see that if we started identifying this source in 2006, it does take quite a while to identify the resources and really develop plans to implement new transportation services. Hopefully in the future we could do it a little bit more quickly than what it took us, but we're really excited to launch the service this year.
Great, thank you. From the county's point of view, what were the goals for the services then? I mean, obviously to address the gaps that you'd identified, but did you have any more specific goals than that?
I think that equity was really a major concern because if you look at the surrounding neighborhoods that communities that do have the flex ride service, there's Louisville and Superior and Broomfield. And so that kind of, if you look at the map, you'll see that big hole of Lafayette. And when we were looking at the populations of Louisville, Superior, Broomfield, as compared to Lafayette, there's definitely many more people of color and Spanish speakers and lower income folks in Lafayette. So it really became an imperative for us to try to fix that situation because the surrounding more wealthy communities had access to an on-demand service, whereas Lafayette, who could potentially benefit from it even more, they didn't. So I think equity was probably our guiding principle, and just quality of life and access to those human services anchor destinations.
Great, thank you. So Lisa Bitzer, I have a question for you. Could you describe the service in general and kind of talk about what's different? Please ignore my phone ringing in the background, my landline. Could you explain what's different between the on-demand service of Ride Free Lafayette and the demand responsive service of VIA's regular paratransit services too?
Sure. With VIA paratransit service, you have to be a registered rider. You have to meet a criteria, 60 years of age and older, and or have a disability. And then, of course, what do we have available to be able to offer you for a ride? Of course, right now, rides are down because of COVID. But pre-COVID, it was hard to get a ride in Lafayette. In the Louisville area, it would fill up fast, and then we would have a wait list, and we try to fit that in. with the on-demand of what we're using with Pantonium, people can still call up and book a ride that way and talk to someone. And there's several things that we're working on to get more people involved through the phone coverage, because it is a long time from a certain time in the morning till in the evening. And I'll let Trish talk about that. But it's, you know, if you have an app, they got the app. If you got a smartphone, if you got a computer, you can go on and you can just schedule your trip. You don't have to call the call center if you don't want to. Although, to my knowledge and the numbers I've seen, a lot of people do prefer to call than use the app. But I honestly think that that has something to do. There wasn't a whole lot of coverage over it, you know, when it was starting, what it was doing. I think we're a little behind on that and working on getting more stuff out. We're looking at rewrapping the vehicle because they see the VIA vehicles, and, you know, get it rewrapped in something different for this promotion. So really that's the difference. You know, you can call in a number or use the app, but right now with VIA Paratransit, there is no app. We're working on that, but right now there is no app to be able to just go on and have the ability to just, whenever you want, go on and try to book a ride and see if you can get it.
Okay. And that kind of reminds me of a question for Angel too, about your grant to do education with training technology, training older adults and people with disabilities to use phone apps and other technologies to increase their mobility. Do you want to kind of talk a little bit about that and how it might relate to this project and maybe some future ones as well?
Yeah. So during our transportation master planning process, we really were looking at some of those advanced mobility options. And we had a steering committee that was made up of older adults, people with disabilities, and caregivers. And we really wanted to get a pulse on what people thought of the new technologies like Uber, Lyft, potential for like automated vehicles and such. And we really had a lot of people say that they weren't necessarily there. They weren't necessarily ready to use apps to access technology, or sorry, apps to access transportation, and that they needed a little bit more assistance. We also conducted a pilot program at Josephine Commons in Lafayette because they are in a transit desert. And so we've been providing Lyft credits for them for quite a while, just because they had no other transportation options. And during that time, we really learned that the power of getting people to use something like Lyft or Uber really was in having ambassadors that are peer ambassadors and can help people learn how to use apps. And we found that the barriers to accessing things like Uber, Lyft, or even RTD mobile ticketing or transit app, they weren't necessarily having a phone or not having a phone. What they really were more just how comfortable, kind of that like social readiness to adopt new technologies. So we currently have a process or a program where we have 5 different apps that we teach people who are less comfortable using apps to access technology. And we really walk people through how to download those apps, how to create accounts, how to use them, and try to build that confidence. On the call here, we have Jeff, who's one of our ambassadors. He's waving. But I think that there are technologies everywhere, and there is more willingness to try technology. But I think that we really need to tap into that like social capital. So friends and peers helping each other learn how to use those apps. Also, there's a lot of barriers to using technology, such as what type of phone people have. I'm glad that people have the ability to request an Uber, a Lyft on demand, or even Ride Free Lafayette. But there still are considerable barriers that we need to address.
Great, thank you. So Trish, you're kind of the person that's on the ground and has your finger on the pulse of how many rides are coming through and all of that. Could you give us kind of an idea of what the parameters of the day-to-day service are and what the volume has been since we launched the program?
Sure. We've from the first 2 weeks in July, because we launched mid-July, we've nearly quadrupled the number of riders that are, well, 10 times the number of riders we had in those first 2 weeks. We've had 303 riders on board our vehicles, taking 275 different trips. And a lot of them do originate out of Josephine Commons. Most of the trips seem to go to the Walmart a lot. A few scattered here and there going to the various, Kaiser or that whole medical facility down in that area. So it is definitely growing. People are definitely using the service. I know that there are still a few things that we're working on trying to promote the app. 75% of the rides scheduled in in August did come through phone calls and not through the app. That was about, I think, 4% of the rides were actually scheduled through the app. And the app will actually let people know when the bus is going to get there. And if it's delayed, it lets them know that as well. So it updates them in real time. So if we can get individuals to use that app to schedule, even if they don't schedule through it, but if they know how to access it to know when their bus will get there, I think we'll connect with a lot more of the passengers than we have been. And that seems to be the one of the biggest issues that we face is the Pantonium system does not collect phone numbers, so our drivers have no way of contacting anyone.
Okay.
And we're almost entirely reliant upon that app being used for a passenger to know that the bus is available. And, they can call in, talk to somebody. We've tracked the buses before for passengers to let them know, well, it looks like they're running just a little behind, they're a couple of blocks away. So, but without that app, without using that technology, we're missing a lot of passengers that we should not be.
Yeah,
There's a question from Andrea in the comments. Have you heard any comments about safety?
No, we haven't heard any comments about safety. Not with the coronavirus, we're limited to the number of people that can ride the vehicle. Everyone's required to wear a mask, including the driver. All of the windows on board. Yes.
Number of people who can socially distance and ride the vehicle, is that?
Yes.
Okay.
Yes. Yeah. So, we have 7 seating rows available inside the vehicle, but every other seating row is even really close for social distance, but it does allow us to get 4 passengers to 5 passengers on board at a single time.
And sorry, I interrupted you before, but what are the cleaning procedures? I think that's probably important for people to know too.
So daily, every time the drivers stop between passengers, as time allows, they are physically wiping the bus down with disinfecting wipes. The buses are sanitized with a fogging setup. I'm not exactly sure what they're using, but those buses do get fogged every night as well.
Okay, nice. So are there any more questions out there right now? Sorry.
I see there's one from Debbie. Is there a process for explaining what Trish just said to the riders at the time they call in to schedule?
We'll answer any questions a rider asks us, but we don't explain. We do explain about the app that is something that they should try to use if they're calling from a cell phone. Our phone system generates an automatic text message to the passenger that actually gives them the link to the website so they can download based on whether they have an Android or an iPhone. So we also automatically generate that link for every passenger that calls from a cell phone.
So I would like to respond to Trisha's comment about that. We are developing a workshop for Ride Free Lafayette. So this is the first time that we've used this platform, but we'll have this this workshop that's really similar to our programs that we do for Uber and Lyft. We'll have it available by mid-October. It'll probably be available before that, but October 20th, we actually are offering a training session through the Senior Center so that we can teach people how to use the app and how to use the website. It's just a little bit slower because of just being busy, right? But we're hoping to incorporate that into our series of workshops that we're offering, because even if you do refer people to the Apple Store or Google Play Store to download the apps, the barriers to really using apps and feeling comfortable are greater than that, right? It's not just being able to download something, it's having the confidence to be able to navigate inside of an app once you've downloaded it. So we're hoping to address that, like that social barrier, or that individual barrier to not wanting to try a new platform. And what we found with our Lyft pilot at Josephine Commons in Aspinwall is there were a lot of people who were holding out. They didn't want to download the app, even though they were getting free passes and free credits through the county to be able to take Lyft. There was just a lot of apprehension about new technology. And then once they were able to go on a trip with one of the ambassadors or some of their friends who had Uber or Lyft, then they really said, oh, this is so much easier than what I thought it would be. So I think for the longer term success of this, I think that we're going to have to really address that technology apprehension to adopt a new app and start using it. And then we'll also have to address that social capital, which is going to be kind of hard to do in COVID times, right? To do group trips to a coffee shop or do group trips to Walmart or wherever people want to go. I think that will probably be the key to getting more people to use the app. And it will be easier and better once they know the benefits of using an app and being able to get that real-time information, but it'll take a little bit.
I think go ahead, Debbie, you want to?
I just wanted to say, with my experience, I teach a creative writing class at the Senior Center, and so I'm working with individuals who are typically 60 and above. And many of them, I'd say a good third of them are 80 or around that age. And when I first offered the class online through COVID, they were like, I'm not going to do that. That's, I can't do that, all that sort of thing. So I had to really hold their hand and offer them a session where I talked them through it, just completely, just get one of their family members at their house to help them sit on that side of the screen while I'm on my side of the screen. I mean, it really took a lot of effort to get them to that point of confidently, now they click on and they come onto the class without any issues. But I really had to do a lot of babysitting.
Yeah, that's interesting. Angel, I was wondering about the workshops. How have you've been conducting them during COVID?
So we had probably, I think it was 62 workshops scheduled for the first half of 2020. And then COVID hit, so we had to cancel a lot of those in-person workshops. We've been able to offer quite a few online. We've been offering them virtually, and we've had fairly decent attendance. If we add up everybody who's attended virtually, it actually is more people than what it was when we were doing them in person January, February, and part of March. So I think that we are getting a bigger reach of people. I just still fear that there's a lot of people who do get frustrated, like Debbie was saying, about joining the meeting. And we're trying to help people, walk them through, here's how you can join the meeting on Teams. And we do things like include a YouTube video that talks people through how to download the app on their device before they join the meeting. And we've also started creating apps prior to the workshop, or sorry, videos about how to download the apps prior to the workshop, because really our model for teaching people how to use the apps relied on us helping them download the apps during the workshops that were in person. And we knew that we just couldn't do that. So we've had to modify by just providing people links saying, here's how you download Uber, here's how you download RTD mobile ticketing. And then hopefully they'll have, at least a good portion of them will have the apps on their phone before they even show up to the workshops. But there is a lot of barriers. And we've even had some people say that they were frustrated and they couldn't figure out how to join, and we'll send them the recording of the sessions after. That way they can just watch that video recording of the session that we held and see if they can access, if they can download it and create it that way, and then we'll talk them through the process over the phone. So total, we've trained 148. Actually, we held a session today which had 4 people in it. So 152 people on apps. There's a lot of repeats there. Like some people are showing up to each of the sessions. But I think that's a pretty good number for the fact that we just launched it this year. It is a lot of, helping people through all of their tech glitches and, just finding out what phones they use, because Android and Apple are different. And that's hard to do virtually, but we're trying. We'll study it and we'll see how we can improve it. We just want people to have options.
This is a jump ball for the whole group. Those of you who do work with older adults and excuse me, and people with disabilities, do you see more incentive among this population to get online? Sorry, I don't know if you understood me. Do you see more incentive for people to get online during the isolation or COVID?
No, I actually do not at all. I had to really almost twist their arm and talk them into, everybody's going to miss you if you're not in the class. We really want to see you there, that sort of thing, to convince them. And I still had, I'm going to say, at least 10 regulars who are no longer regulars. Now I've brought on a new crowd of regulars, but no, if they're dead set against it, there was nothing I could say to convince them.
So
Andrea,
I do think,
sorry. I think Andrea wanted to say something as well.
Oh, I was just going to comment on 2 personal experiences. My girlfriend is exactly my age, minus plus 1 week. And she is really afraid of the computer. I keep trying to give her an old cell phone of mine. She does not want to get involved with that. She does have a flip phone, but it doesn't do much. She just is so afraid of the technology, and I'm a geek. I've been doing stuff online since 1984, so I have comfort. But she'll go online to search for airplane tickets, let's say, and then she calls the company to make the reservations. And I just find that so frustrating, but she's so afraid somebody might find out who she is on the internet. And I think that's the big scare among us seniors, that somebody's going to find out who you are. Get your phone number, get your social security number. And if you didn't start when you were much younger, it's really hard to come into it after all the news.
So I do want to say, Lisa, that there are organizations that have made huge strides in getting people online. I know that the Center for People with Disabilities has been holding their support groups through Google Hangout or Google Meet, and they have pretty good attendance. They hold the peer support group sessions, I think, once a week. And also they have been helping people set up their devices either over the phone, but they've been helping them set up their devices so that they are accessible. That's something that's beyond my knowledge of technology, but you can set up things like screen readers, or where it'll automatically enlarge certain things for you on your phone. And also the Boulder Public Library has a virtual tech help that we've been able to send some people to, because really for our program, we know transportation. We don't necessarily know the in and outs of all the technology. So if people have questions about how to use their phones or how to download things that aren't necessarily transportation related, they can get matched with a volunteer through the library. And this is available to anybody in Boulder County, not just City of Boulder. They can fill out an online form, and an ambassador, or I guess it's just a volunteer, will call them back and set up a time to really go over what their tech issues are. So I'm hopeful to see that there's more support for people who maybe weren't online prior to the pandemic, but are kind of being pushed in that direction
Yeah.
because of like the social interaction.
We've seen a large increase in booking online here at VIA for the paratransit. People that I would have never thought would go down that road. I think being COVID times has sort of made some people, whether they really want to or not, have to look into that option. So for us, it's just the opposite. We have more people booking online than we do calling the call center, which is odd for us.
Excellent. That's
Usually been-
excellent.
Yeah.
Arapahoe Library has that same program, exactly like that, to teach people how to use their technology.
A couple more questions have come into the chat. First from Sandy, would they allow a workshop to go to Josephine Commons?
So we're not doing in-person events. We are working with Josephine Commons resident coordinators. So I do attend their resident meetings just because I have the Lyft pilot and I have a GoGo grandparent subsidy that we have for some of the residents there. So all of the events are remote, virtual. So we do work with their resident coordinators, and we're encouraging them at this point to attend the sessions that we have through the senior center, just because we already have them scheduled and we want those to be successful. But we have offered to do any sort of training that they need remotely.
Thanks. And last question so far, David asks, do you have very many people using RTD's low income live app?
So I guess I can take that one if, I don't know if anybody else
I was
wants
going
to.
to say, we're not tracking it with the RTD Flex Ride system. It's just, they show us the card. Okay, you get on board. We mark the appropriate fare, but it's not, we mark it as a pass. It's not a thing that's tracked with us.
Yeah. So RTD recently created a series of videos to promote the LIVE program. There haven't been very many people who have signed up for it. I will put in the chat box, like some of the videos and links to that. The videos that they've created are really good. They just published them, I think, last week or the week before, but they walk people through how to sign up for the LIVE program. I think what the barrier with LIVE has been is people signing up and knowing that they can sign up for the discount. So for those of you who don't know, the RTD LIVE program is for low-income households that are at 185% of federal poverty line. And they have to apply through the Peak Connect system, which is the system that all of the food stamps, the SNAP benefits, the Medicaid applications go through that system. If people are already on food stamps, SNAP, or Medicaid, they can automatically get approved for it. So they would still have to apply for the RTD LIVE discount, which is 40% off of the regular fare, but they would just automatically be approved once they applied for it. What some of the barriers have been are that you have to upload a picture that meets their criteria, and the videos go over this really well. But in Boulder County, we currently only have 265 people who have been determined eligible. I'm not sure how many people for Boulder County actually applied. But that's one thing that Boulder County, through Mobility for All, we're going to be trying to promote over the next 4 months or so, is trying to encourage people to sign up for that discount fare program. And I think when you were talking about the app, David, that you were talking about how people can purchase Live Fare Media through the RTD mobile ticketing app. I don't have any data on how many people are purchasing those Live passes through the app versus purchasing the separate tickets or the RTD Live My Ride cards.
Thanks. We've also had another question from Gary. He asks, is this available in Lakewood, Jefferson County?
Are you talking about the RTD Live program or the Ride Free Lafayette?
Carrie, would you mind providing some clarification?
Well, everything I've heard so far is Ride Free Lafayette, which is not in Jefferson County.
That is correct. Ride Free Lafayette is just available in the city of Lafayette in Boulder County, but the RTD discount for low income is available throughout the RTD service area. So anybody throughout the district can apply for that discount, that 40% discount, if they think that they are at 185% federal poverty.
No, I joined this webinar because it was offered by email to learn about VIA.
Yes, and maybe we didn't make that clear. VIA is the transportation provider for the Live Free Lafayette program. And also we also operate some of RTD's Flex Ride services which are offered throughout the Denver metro region as well as parts of Boulder County. Are you a resident of the Denver metro, Gary?
Well, Jefferson County, and I got an email that VIA had assumed the scheduling responsibility from Senior Resource Center.
That's true. That's true. And I'm wondering if our CEO, Frank Bruno, who's on the call, might like to welcome you and answer your questions about VIA if you have some.
Good punt.
Yeah. I'd be happy to. Gary, you're quite right. Back on July 1st, we did assume the rides, the business portion, paratransit portion of Seniors Resource Center, and many of the vehicles as well. And that service in the SRC territory has been initially funded by the Denver Regional Council of Governments, and that's through the end of this calendar year, so only through December of 2020. The counties were a little bit late, brought late into the game by SRC in terms of being made aware that they were going to cease operating as of June 30th. So the counties were scrambling a little bit, hence Dr. Cog, Denver Regional Council of Governments' decision to step in and fund service in the 4-county metropolitan area that SRC had been providing. At this point, we VIA are working with the county representatives, and it's at various stages. Arapahoe is very much engaged with us right now. Adams is getting a bit more engaged. Denver is. And just today, I wrote to the county commissioners in Jefferson County. I spoke to the Jeffco Council on Aging back on July 9th, and there were a lot of people on that Zoom call, many who expressed desire to see more service in Jeffco, a desire for more. And I followed up also with the Director of Transportation for Jefferson County. He used to work for me at the City of Boulder. And now I've been invited by one of the county commissioners to reach out to the commissioners to really introduce VIA and give the top level of government of Jeffco a better understanding of what VIA is. We're a 40-year-old nonprofit community transit provider that has provided paratransit service. And we also provide contract service for in Boulder for something that's like a municipal bus route. And we do, as has been mentioned, Accessoride and FlexRide under contract to RTD. But we do these special shuttle services as well that we're growing that are growing in popularity. And we want to do an awful lot more in Jefferson County. I would say at this point, of the 4-county metropolitan area, Jeffco is probably, it's our least developed portion of that new business. But we're working hard on trying to get that a little bit more robust as quickly as we can. And, you know, again, some of that going into 2021 will be very dependent upon funding. We can't, as a nonprofit, you know, we really can't provide service without some measure of funding. We use some of our own earned income from our own contracts to cover some paratransit, but we really need funding from the counties or the municipalities. So that's why we're working with them now to try to line that up for 2021.
Thanks, Frank.
Gary, did that help answer more?
What I heard was that Jeffco is behind the other 3 counties in terms of implementation. And that might be the reason why here at the 43-minute point of this meeting, it has been Boulder oriented.
I would say so. I would say that, you know, I would say it's probably the same for the other 3 counties as well, that we haven't spoken about the other 3-county metro area as much as Boulder County. And that's just a fact of life that as of July 1, we've stepped in and taken over this SRC business in the 4-county metropolitan area, but it's growing. And it's, you know, it's just that we've been doing these other services for many years. And since July, we've taken on this new bit of service and trying to grow it as quickly as we can. So I think you're right. That's why you are seeing a Boulder-centric view, which is, you know, certainly not intentional. And while we believe and are committed to our clients in Boulder County, we are equally committed to clients that we are taking on in every single one of the counties and jurisdictions. And that's very important to us. Everything we do is a mission service, and anything we do in Jeffco will be every bit our priority. And I promise you that that's something that we believe deeply, all of us on staff and on our board of directors. We have a couple of our board members, I believe, on the Zoom call here as well.
This is Gary. Thanks. You've answered my question. I appreciate it. Zoe, you might want to voice Lyndsay's question because I think it's a good one.
Also, Gary, before we get into that, Lyndsy here, hi. I would love to invite you to our event next week where we will be focusing specifically on our new service area in the Denver metro region. We have a town hall coming up that's going to focus on that 4-county area, and that's going to be Thursday at 10 a.m. So we'll share more of those. If you're already getting our emails, you'll definitely get a reminder about that one, and you can sign up for that Zoom meeting as well, and that will be solely focused on that new service area.
All depends if I can get via transportation there.
It's a Zoom meeting as well. Yeah, we're
Okay.
not doing any in-person events, unfortunately. We really like to do these town hall meetings in person, but because of COVID, we're doing everything digitally right now.
Thumbs up.
Thanks, everybody. My next question sort of, and I'm sorry if we weren't clear when we sent out the invitation that we kind of focused on an on-demand project that happens to be in Boulder County. One of the areas that interests me in particular about on-demand services is integrating our paratransit clients with our public transit options, so that we don't separate out the paratransit riders so much from the regular public transit options. And one of those areas where that can happen is with on-demand services. And we're seeing more, and we're hoping to see, I think, a lot more on-demand projects in different communities around in all of the counties that we serve. And I'm wondering from the panel if with the Ride Free Lafayette, if we've seen a lot of people who might have been our paratransit clients riding on Ride Free Lafayette, which is a public transit service. And are we seeing people who also riding who would not necessarily meet the requirements for our paratransit services? Angel, did you want to?
I can definitely speak just to an anecdote that I heard. So I work with a lot of people with disabilities and older adults. And recently, Dawn Russell, I'm not sure if you know who she is, but she's a huge advocate in ADAPT. And she was really active in getting wheelchair lifts on RTD. And she's a huge advocate for transportation access. She recently reached out to me and said that she loves the service. She's a Lafayette resident, and that she was really kind of in denial at first when people were telling her that there's this free on-demand transportation option. And she heard it a couple times and she was just kind of blowing it off. And she did speak a little bit to the fact that people were confusing the service with either Access-a-Ride or Via. And she had seen, or one of her acquaintances had seen somebody who did not have a disability getting off of the Ride Free Lafayette, going to a happy hour. And they basically were saying, why are you using Access-a-Ride? And I guess the gentleman was like, I'm not using Access-a-Ride, it's a new service. But once she started using it and realizing that it was legit and that it was really free and it was really on demand and that it was really available to anybody in the public, she just fell in love with it. She said that there was pride that she felt like she does when she gets onto any RTD bus, like the ability to be able to travel independently whenever she wants to go. But she said that she felt valued because it was free, one, and then two, the on demand. She said that by the time she decided to try it, she Googled the number and she was able to get on the bus within 20 minutes after Googling the number to call. So it just spoke to like the dignity that it brought to her. And it just really was a happy story. And I'm glad that Via and Boulder County and all of our partners can really do that for people and give them the dignity of being able to go where they want, when they want to go there.
Well, thanks for sharing that. Lisa, it looked like maybe you had something to.
Yeah, I think that it's great because Via can't always provide every ride for every person. So the more options someone has, the better, especially out there in Lafayette area that grows, been growing leaps and bounds. And I think that there's always going to be the people who need Via paratransit that need that extra help, that they need that arm, they need that door-to-door, door-through-door service. And then there's the people that can do curb to curb and get around where they need to go, and that they're more ambulatory or even in a wheelchair, that they're more comfortable using other kinds of transportation. So yeah, I don't know if any of our riders have gone over and tried Ride Free Lafayette. I'd have to look at the names and see if I recognize anyone, but I imagine that some have, that they're able and comfortable getting around, and it's nice to have that on-demand option that Via currently doesn't provide in the paratransit division.
Well, we don't have, everybody's tracked by their email addresses. We don't keep their names. All of the accounts are under their email address. So no names, no phone numbers, just an email.
Okay.
But speaking to what we did prior in Longmont, there are still passengers that use whatever service happens to be the most convenient for them on that day that they need transportation.
Yeah, absolutely. When we did that, when VIA combined with FlexRide, and we combined the two services, no extra drivers, no extra buses. We just used what we currently had. We did it for what, about 5 years or so. It was quite a while.
Yeah.
Quite some time, and we increased ridership by 35%, pretty much right out of the gate, with no extra service or buses or drivers. And so to this day, I agree with you, Trish. We still have people that if FlexRide isn't available, they call VIA. If VIA is not available, they call FlexRide. So we definitely enhanced people's ability to use different transportations to get where they need to go in the Longmont community. That was a good project, and it worked really well.
This is another jump ball for anybody who's on this call. Would you want to see more on-demand public transit options in your community? Is that something you've thought about before? Do you think the convenience would make you drive less and take public transit more? Just curious to see what people think about that.
Honestly, if I had transit in my area at all, I would probably use it. But I live out in Weld County. I'm in Meade. There's no transit out here at all. It just doesn't exist for us.
And Arapahoe County uses the VIA service since SRC, and there just aren't enough rides. Sure, I would use it, but they instituted you have to sign up 2 weeks in advance, and I know lots of people have been left in the lurch when they just decide the day before they want to have coffee with their friend or something. Mm-hmm. Yeah, we definitely need more than we have now.
Yeah, we're going to be making some changes on how things are done versus SRC versus via paratransit down in the Denver metro area. You can book same day if we have it available. We gladly give it. You can book up to 7 days in advance, not 2 weeks. And we're going to schedule right at that time when someone calls the call center. This will all happen October 1st. That's sort of when we're flipping the switch and going live with our database. So when you call, you'll know right there and then that you have a trip or you don't, and it's on the wait list. So there'll be a lot of exciting changes, the availability to book online once you're a registered rider, or if you were registered and brought over on the software. So we have some exciting things in the work that I think people are really going to enjoy, give them a little bit more freedom, give them a little bit more options, and to know right there and then that they have a trip versus call back in a few days to see if they were able to fit you on. So we will be making some definite changes for the better for the riders and the experience.
And I would like to also mention that we're looking at expanding on-demand services, not in the immediate or near future, but over time we'll be, we have this project that's going on in Lafayette. We have another more limited area on-demand project that we're working with the city of Boulder as a pilot project to see how that might work in paratransit. It looks like Frank would like to expand on that.
Oh, just to say that we're also deeply involved right now in building a strategic plan that we proposed to our board of directors at our retreat in February. We thought that, with the onset of COVID, that, boy, we were going to be shut down on that plan until maybe next year, but we decided to pick it up in midsummer, and we have made a lot of progress on it. We're going to our board at the end of the month with a significant update, and it will help drive a lot of these decisions. Lisa was just laying out basically Lisa as well. And so we're very excited that we'll have this document that'll help us help our board and help our leadership team make wise decisions. So looking forward to that. And for our board members on, I think Katie and Debbie are the two. I think you guys are going to be really pleased with the progress so far.
And David Cook, it looked like maybe you wanted to jump into the conversation a minute ago.
Yeah, I'm on that jump ball. I'm a little late on it, but I was on a call this morning, or at lunchtime actually, with a consortium of universities, and I believe someone was mentioning the idea that a on-demand service might yield a more cost-effective approach than a fixed route service during these times when ridership is so low because of the pandemic, and get people where they need to go possibly more quickly and more directly. I don't know if you have any background on that, but it sounds plausible.
Yeah, it does. And if you had, we're expanding our fleet of electric vehicles. And so if you had low or no emission vehicles that were providing these services, it would certainly, as opposed to someone driving themselves individually in a car, these shared ride services can be more efficient in terms of, the carbon emissions from the vehicles and that sort of thing. So it's possible. One of the other things that can happen too with having on-demand services is when you're capturing all that data about where people are going and where they're going from, you can begin to see where maybe fixed routes might be very useful. A regular, you can see where people really actually want to go. So there's that aspect of demand services may eventually evolve in some cases into fixed route services that are more efficient in that way, because they're really providing a very clearly defined needs that way. Does anybody else want to have anything to add? I've enjoyed the conversation today. It's been quite lively. And on-demand services is really something I'm very interested in. We didn't get to, and I apologize. I introduced the panel and we didn't go around and introduce individuals. Would people like to kind of introduce yourselves to the group?
I have a comment.
Sure.
George Maxey. If I'm not knowing how your ridership is coming or being used, the question I would have is there a monthly calendar that all it says is seats available? If it's a random designation, that you still have to make the necessary plans. But I'm speaking now of seniors who are a little more flexible than people who are working or have some sort of time schedules. But the point is that when you go on there, it says that on the 15th of the month of a month, we have 5 seats available. Don't know where you're going to go because you're going to have to make contact with us. My sense of this is that maybe you and neighbors are going to would want to go to the same place. And then when you go on to the same, because this calendar has to change literally moment by moment as times are scheduled. In other words, if 15 minutes later that there's two other people had actually scheduled something for that time, now it's down from 5 to 3 available seats. The idea here is it lets the rider a little more flexibility about when they might want to go someplace. If not today, tomorrow, or
Okay.
whenever.
Yeah, that's an interesting idea. I'm going to let our operations director answer that. Lisa Bitzer.
Yeah, it's not really done by seats. It's done, the system is quite complex. So it knows if you have someone that is in a location and they're, let's say they're going to Walmart, and you've got 2 or 3 other people that are close by in that vicinity, and they're going to that Walmart. The system will automatically piece them together. And of course, with COVID, you can only put so many in a vehicle at a time. So the system knows how many seats that the vehicle can hold. The system knows where everyone's pickup address is and where their drop-off address is. And it's works very well to combine those trips and make it as efficient as possible. So the system sort of knows the seats that are available, but the general public would not. You would not. It's not like an airline where you can see, like, you know, I can pick this seat, that seat that's available. It doesn't quite work that way, and I don't know of a software currently in the transportation world of vehicles that does. But it does it it does it in a different kind of way and in a different format. But it does think, it does know point A to point B, and you know, getting as many people in that direction as possible.
Well, I'm watching all the systems that are out there trying to move people around or provide services and resources. And the only thing is I'm a futurist by nature. And while I've been through I'm old enough, I've been through major pandemics that killed the last one of major import was 57. And that, I think it killed over 100,000 people here in the States. But the point is that what we are doing right now, is going to carry through to a future of no pandemic for at least I'm hoping another 50 years. That's been historically about the time frame for major pandemics, going back literally thousands of years. But the point is that we are trying to develop a program that's going to be considerably more flexible than what is existing now, and more useful to the general public out there. However we choose.
Yeah, I think technology is always going to evolve. You know, who would have thought that we would be using tablets instead of paper manifests 10 years ago? It didn't exist. You know, so things are always going to evolve. Something better and greater and newer will always come along. And so really the question is, one, can we afford it? You know, who can afford it? Number two, how do we get that money, and how do we make it a better experience for the rider? And so I think you will see big change in the next 10 years. Probably how we do it now won't be how we do it then. I think as things evolve, so that things are coming. I just think that, you know, for now we're doing the best we can with what we have to offer.
Well, I'm pleased with what I see going on. But
That's
then
great.
I'm speaking as a senior. I'm still mobile, and I driving my own car and everything. But the point is that's coming to an end in the next probably 5-10 years. But the point is that I see this coming, and I want to be as helpful as I can to those people who are thinking ahead to make this a better community to live in.
That's a worthy goal.
Well,
We've reached the end of our hour, and I appreciate so much everybody's participation, and I want to thank our panelists. I thought it was a lively conversation. I enjoyed it. If anybody has any ideas for topics, please shoot me an email, lcurtis@viacolorado.org, and we'll consider it. We've got that upcoming town hall for everybody who's in the Denver metro area. And we also have the first Monday of every month, Morning Cup, which begins, Zoe, correct me, at 10 a.m. if I'm wrong, 10 a.m. So if you're on our mailing list, you'll get information about that. We'd love to hear from you and hope that, and if you've got any ideas for topics for Morning Cup as well, let us know. I've really enjoyed this. So Transit Talks over and out. Thanks. Bye.